And the first time I heard someone talk about TMS, they explained it as they put a magnet over your head and it helps with depression. And I was extremely skeptical because that sounds very weird. And it kind of is weird. Hey guys, I have not posted a Spravato update in, I think it's been 2 weeks now. That is because I have had to take a little bit of a break from Spravato treatments just because of insurance situation. I'm hoping that that'll get resolved soon and then I can resume making those videos. But since I don't have any video to make about that today, I'm going to talk a little bit about another new treatment that I've started, which is called TMS. So TMS stands for transcranial magnetic stimulation. And the first time I heard someone talk about TMS, they explained it as they put a magnet over your head and it helps with depression. And I was extremely skeptical because that sounds very weird. And it kind of is weird. But I did a little bit of research myself and I learned that kind of what it does is they do put a magnet against your head and it makes a electromagnetic field, I guess, and it kind of delivers a magnetic pulse into your brain. And so they put the coil right here pretty much. So it's on the left side of my head, kind of a little bit back from my forehead. And that, I guess, is the area of your brain that is responsible for emotions. So what this does is it delivers a little magnetic pulse into that part of your brain that controls your emotions. And they have shown that this helps relieve depression symptoms. So it is a bit of an intense treatment, not in terms of, just in terms of time, I guess is what I'm trying to say. So the treatment itself is actually really easy. It is 5 days a week for 4 to 6 weeks, sometimes a little bit more, kind of depends on what the doctor decides is best for you. But the appointments themselves are only 20 minutes. So the appointments are 20 minutes a day, 5 days a week, and they're super easy. So the first appointment was like super weird. So what they do at the first one is they want to get an idea of where to place the coil and how much magnetic power is needed to affect your brain. So the way they did this is they put the coil on my head and then the doctor would make it deliver a pulse and see which part of my hand it moved. It was like very strange at first because I had they were doing it on the left side of my head. So I had my right arm up on a chair and then they would pulse and then my fingers would twitch. At one point they made my whole like wrist move. Once they figured out what made my wrist move, they then moved it up and down a little bit until it made all of my fingers twitch. And then they actually got it to move each finger individually, which was super strange. So like they would deliver the pulse and get just my ring finger to move or just my index finger or just my thumb. And they did this. This part took about 25-ish minutes to get everything set up. And once they had all of those like locations and how much power was needed to move my hands, they positioned the coil where it would need to be in order to affect the area of my brain that controls my emotions. And then I just sat there for 20 minutes while it pulsed. It's strange. So they described it to me as like a woodpecker, like tapping against the side of your head. I thought it was a little bit more painful than I would imagine that to be. TMS in general is not super painful. It doesn't require any surgery. You can drive yourself to appointments. You don't need any anesthesia or anything for it like you do with something like ECT. So I liked that about this, that it was much less invasive than a lot of the other treatments. So I thought it was a good starting point for me. I will say in the beginning, it was pretty painful. It wasn't like anything that I couldn't tolerate. It just wasn't like, I wouldn't have described it as a woodpecker tapping the side of my head. I kind of described it a little bit more of like somebody hammering a nail into my head. But it wasn't like overly painful. It was uncomfortable, but it wasn't that bad. The sessions themselves have been super easy. So I just I sit in like a super comfortable reclining chair and watch TV for 20 minutes, just whatever's on. They lately have been having a dog training show on and I'm too awkward to ask for the remote. So I just sit there and watch the cute dogs, which I think is great. It's nice and relaxing. So with TMS, generally people don't notice a huge difference right away. So the treatment, like I said, is usually 6 weeks, 5 days a week. And in the beginning, you won't really notice a change and you might not fully notice the change yourself. again, it might be like one of those things where people around you are going to notice a little bit of a difference in your mood kind of before you do, which is frustrating, but it's better than nothing. And with a treatment that's as easy as TMS, it's probably worth it. And so there are some side effects with TMS. The one that they tell you about in the beginning, kind of the most severe, is that it does increase your risk of seizures just a little bit. So if you're someone that's never had a seizure, like I've never had a seizure, they're like, the chances of it giving you a seizure are extremely, extremely small. And then they're a little bit more careful with people that have a history of seizures. The doctor kind of has to then evaluate you and see if the treatment of TMS is kind of worth the risk of potentially causing seizures, but it's super rare. The most common side effects are headache and a little bit of discomfort at the site of the coil. I sometimes, when I go, it's kind of different depending on the day for some reason for me, but sometimes I have a headache for maybe 30 minutes after the appointment, and honestly, I can just take Tylenol or aspirin or something and it goes away. I do get a little bit of pain at the site of the coil as well. So the coil is pretty big. So it's probably like the size of my hand, and it does cover, the whole side of my head. But wherever, I guess it's where the magnetic pulse is generating from, like I can kind of feel that like hitting the side of my head a little bit, and that causes some discomfort. And another common side effect that I have as well is it can make your face twitch while you're getting it. So that's not something for me, and I haven't seen any stories about this being something that lasts. It's more of just like during the treatment when you're getting those pulses delivered, then you can get like a little bit of pain there, but it doesn't last. It doesn't like stay, which is good. So it's easy to deal with. And I was really confused the first time, honestly, because nothing is actually hitting your head when you're doing the treatment. And it really, really feels like something is tapping like really fast against the side of your head. And it's like 5 to 10 seconds on. And then I think it's like 15 to 20 second break. So you kind of like cycle through different, I think it's different powers and different, pulses. So they start you at a low power. I don't really know what it means, I guess. It's like kind of the amount of energy that the electromagnetic field is producing. So they start you at a lower level, which you don't really feel as much, and then they slowly increase the power until they get to what they determine is the power that you need in order to make a lasting change in your brain. So when they first put my power level up, that's when I kind of noticed the most discomfort, was right when they increase that power level. And they do it very slowly because people do think it's a little bit painful. So they kind of slowly ease you into it. Once I got used to it, it doesn't really hurt, doesn't really bother me. It does sometimes make my eye twitch or my eyebrow twitch, but that's about it. And yeah, it was like so strange because I thought for sure something was like actually tapping the side of my head. And that's why my face was twitching. And that's why like I kind of like sometimes it would like make my teeth hit together. But nothing is actually doing that. It's just when the magnet itself releases its little pulse, it kind of feels like something's tapping your head, but nothing is physically hitting your head. The coil is just placed against your scalp. And that's pretty much it. I think I've done about 2 weeks of the treatment so far. And again, I haven't really noticed a huge difference, but I'm kind of hoping that over time, and especially combined with this Spravato treatment, that this will cause me to feel a little bit better. In a lot of the research I was doing about TMS, it doesn't seem like people know exactly why it works. They know that the magnetic pulses themselves help stimulate the neurons and the cells in your brain. And something about doing that is helping your brain to have a little bit less of the depression symptoms and just to feel a little bit better overall. I was actually warned when I first started that sometimes people in the first couple weeks of TMS will notice a worsening in their symptoms. And again, they're not really 100% sure why this is something that happens. But for me, it didn't really happen. So that was good because, I mean, in order to get TMS, you generally have to have treatment-resistant depression. So you have to have tried a bunch of different antidepressants and had little to no benefit from them. So, for someone like me going into TMS where my depression was already extremely severe, I didn't really notice a drop in my mood. Like they said, some people feel a little bit worse. I didn't get that, and I think it's because I was already pretty severe going in that there wasn't really much room to go down, I guess, as sad as that sounds. But I guess it's good. And like I said, the treatment is so easy. It's the discomfort is not that bad. It goes away pretty quick, and you can drive yourself. The typical appointment is only 20 minutes, so it's really really nice. I had never heard about it until a couple weeks before deciding to try it, just because it's not something that you hear about that often. But it's really cool. It's interesting to see that there's a lot of different options out there for people with treatment resistant depression like me, because I was starting to think that I wasn't going to have any options to try when all of the antidepressants weren't working. So I'm really excited to see how TMS goes for me, and I will keep you guys updated on how it is going. If anyone has any questions about TMS or about treatment resistant depression or about anything mental health related, please feel free to leave those in the comments, and I will do my best to answer those as best as I can. And I hope everyone has a good day. Thanks for watching.